So I want to talk to you about supine exercise in pregnancy, also known as lying on your back. This is something that comes up all of the time when women first get pregnant and they're not sure what they can do for exercises, whether it's mat-based exercises or it's things like your bench press, your chest press in the gym. So currently, all of the guidelines state that we should avoid supine exercise when pregnant after 16 weeks of pregnancy. And this is because when you lie flat on your back, you compress the major blood vessels in the back, and this can lead to symptomatic hypotension. That simply means low blood pressure in the mother. This low blood pressure can lead to symptoms of dizziness, lightheadedness, and it can generally just disturb their bodies. And when you're already physiologically compromised in pregnancy, we don't want to exacerbate that any further. This can also, this reduction in blood pressure can also reduce the oxygen supply to the baby, and this can cause the baby's heart rate to increase. So we want to avoid distressing the baby essentially by keeping their heart rate at a steady pace. So there are different alternatives that we can do. So instead of lying flat down on your back, we can take an elbow position here so that you're avoiding the compression, and you could do your Pilates exercises here, for example. We could also prop ourselves up into that position. As long as your top half is raised about 30 degrees, then it is safe. So you can use pillows, a bolster, or an arc barrel. We could take side lying exercises, or we could take exercises on our hands and knees, all of which are completely safe and they avoid the compression on the spine. Now research, although the research in this area is small, the studies did reveal that about 30% of women did experience these adverse effects. Therefore, to avoid all risk, we just generally avoid them, and there are lots of other alternatives that we can do instead. The research also suggested that low intensity exercises don't affect the cardiac output in the mother, and therefore some supine exercises for up to 2 to 3 minutes can be okay as long as they're low intensity. Now the key here is low intensity, which differs for everyone and it's hard to gauge. So you could do a very low intensity exercise and then change position as long as you're not in that position for more than 2 minutes. However, if in doubt, it's best avoided just to stay safe with things.